Good morning, my dear students. How are you? I hope you are fine. Okay, stay at home. Okay, we are discussed last three episode: brain, neurons, spinal cord, everything we are studied. Okay, today's class we are talking about autonomous nerve system and this is affected by nerves. That is we are going to discuss. Okay, let's start. Okay. Dear students, are you remembering peripheral nerve system I told? What are the peripheral nerve system? Yes, cranial nerve of brain, spinal nerve from the spinal cord together is known as peripheral nerve system. Today I am talking about autonomous nerve system. Autonomous nerve system means your life may be in the situation when you are felt sudden fear or sadness. What will happen? When you are attending to the fear, sadness, you become a heartbeat increases, saliva decreases, trachea expand. This all physical behavior changes, right? Can you give some experience in your life when you become a sudden fear? Yes, seeing the snake suddenly, seeing the accident on the road, or when you are very lately to reaching the examination hall on the situation you become a fall suddenly fear and sadness, right? On that time what will happen to your physical behavior body during the such a emergency situation? This is known as emergency situation. What will happen? Heartbeat increases, saliva decreases, trachea expand. This all body changes in during the emergency situation. Yes, no? Okay. Look at this page number 18. Look here, sympathetic system and parasympathetic system. Both is together is known as autonomous nerve system. You know, activity take place beyond the conscious level are controlled by autonomous nerve system. When you are getting fear, sadness, when you are relaxed, this is all our activity take place in conscious level. That time who control? Autonomous nerve system control. Example, you are attending to the fear. That time heartbeat increases. That time sympathetic nerve system control your body. Not allowed to increase more heartbeat. What will happen if your heartbeat is increased in a limit? Chance to be death, right? That time autonomous means sympathetic nerve system help for you to control. In emergency situation, sympathetic nerve system helping for you. In relaxed time, parasympathetic system helped for you. Let's look. When you are attending to emergency situation, that time sympathetic nerve system helping. What will happen to what will changes occurs? Look, in eye pupil in the eye dilate, and production of saliva decreases in the mouth when you are in attending to the emergency situation. Trachea expand, understood? Expanding how? Breathing more. Okay, in oxygen level grabs inside more and leaving. And you have respiration. Okay, heartbeat increases during emergency situation. Gastric activity slow down, means stomach activity slow down. Next, glycogen is converting into glucose. You know, in our body, glycogen and glucose normally glucose level in the body 70 to 110. More than 110, less than or 70 is affecting to the diabetes. Means glucose level 70 to 110. In the emergency situation, temporary glucose level. Okay, normally how much glucose level I told no? 70 to 110. In the emergency situation, what will happen? No, our glycogen is converting. Glycogen is same as bitter, is converting into glucose, means sweetness, and storing in liver. Later, peristalsis in the intestine slow down. Peristalsis activity slow down, not speed up. Similarly, production of hormone increases. Different hormone is there in our body. Okay, your kidney, adrenal gland, production of adrenal hormone, that production increases. Then later we can study okay hormone. Urinary bladder regain normal state. Urinary bladder chance to be open. Okay, this is all activity take place when you are attending to the emergency situation. That time sympathetic nervous system control your body. Same as okay, your example, you are best example I'll say, your exam may be 9:30, but you are lately entered the school, maybe 9:35. That time now you are outside 9:20, you are on the road. On the situation you started to get the fear. What fear? I want to reach to the examination hall, want right, anybody will be scolded or not. That time no sympathetic nervous systems are taking place in your body. Okay, later you are reached the school to the door of the examination hall, even though you are in the emergency situation. Then invigilator told, okay, don't worry, you can enter and sit in your place. That time start to you relax. Are understanding? When relaxing time, parasympathetic system helped for control your body. Means that time what will happen now? Look at the figure. Parasympathetic system means relaxed time. Eye pupil contracts. What happened in the emergency? Eye pupil dilate. If you studied sympathetic nervous system, it is easy to study parasympathetic system. That is opposite of parasympathetic, opposite of sympathetic. Okay, eye pupil in sympathetic dilate, here eye pupil contracts. Production of saliva increase in parasympathetic in relaxed time. And trachea contracts, not a dilate, expand. Expand is sympathetic. Heartbeat become a normal. You are normal in stage. Now in the examination hall. Best example I told. Here gastric activity become a normal. Start to activity of stomach. Glycogen converting into glucose in sympathetic. Here glucose converting into glycogen in the liver. Later production of hormone decreases and peristalsis in the intestine become a normal. Everything came to the normal in the parasympathetic. Urinary bladder become closed, means contract. It is very important in examination. This all number of points will give you and tell to you make two column, sympathetic and parasympathetic, and select the answer which is related to sympathetic. You write in the sympathetic column. Parasympathetic belongs to parasympathetic. Okay, number of time I asked such a questions. I hope you are understood there. Understood now this one? Look at this page. This is your homework question. Okay, page number 18, that also homework. This is also homework. Here you have to draw like this in your notebook. Make 3 columns. You have to complete. Here no action of sympathetic and parasympathetic system during means emergency situation. What will happen? You have to write a sympathetic system. When you relax time, what will happen? You can write parasympathetic system. Means pupil. What will happen in sympathetic? Pupil. The pupil in the eye dilate. You have to write. In the third column, parasympathetic, pupil in the eye contracts. And salivary gland, production of saliva decreases. In third column, parasympathetic, salivary means production of saliva increases. Next, trachea expand, their trachea contract. And heartbeat, what will happen? Sympathetic, heartbeat increases, their heart become normal. Next, stomach, what will happen? Gastrical activity slow down. In the third column, gastric activity become normal. Later, liver, what will happen to the liver? Glycogen is converting into glucose, their glycogen converting into glucose converting into glycogen. Later, intestine, what will happen? Intestine, peristalsis in the intestine slow down. In the third column, right, peristalsis in the intestine become normal. Later, urinary bladder regain normal state. There last urinary bladder become contracts. This you study and write. Okay, and okay, next Look at this page number 19, table 1.3. What this is affecting the nerve system. Okay, defect affecting nerve system. Number of diseases related to nerve system affecting. Okay, only 3 is discussed in the textbook. Disease look on Alzheimer's, Parkinson's, epilepsy. Alzheimer's. Most Alzheimer's and Parkinson's can see above 60 age. Okay, above 60 most. Nowadays is not. Nowadays maybe is under the 60. Okay, because lifestyle changed, food style changed, environmental factor, everything is affected. Okay, anyway, Alzheimer's. Look at the causes. Accumulation of insoluble protein in neural tissues of the brain. Neuron get destroyed. You know, in our brain, numerous neuron, right? In neuron, in neural tissues, most protein is accumulated. Here what happened? No, most protein is insoluble in the fluid. Not so. Actually, in normal, protein must be soluble in the neural tissue. Here what happening? No, protein in the neural tissue become insoluble. That time what will happen? Accumulation. That side become that part become a swallowing shape. Okay, what will happen? Neurons get destroyed. Most important neurons will get damaged. Then what may be the symptoms? Loss of memory. Everything is going to forget. Loss of memory. How? Inability to cannot recognize friends and relatives. Can't identify, even though he is become our part of life, but the patient cannot identify us. Understood? Unable to do the routine works. What's mean by routine works? What will do? What will do? Normal person what will do? Get up morning and brushing and bathing and taking breakfast and entering to the next activity like this. This is routine works. Okay, same this routine work they don't know. Patient don't know what how to do next. They become silent and become a depression. This is known as they don't know, inability to do the routine works. Next, Parkinson. Parkinson means destruction of specialized ganglion in the brain. You know, ganglion means group of nerve is known as ganglion. What Alzheimer's what happened? Neuron tissue destroy, insoluble protein accumulation. But here destruction means what? Damage specialized ganglion in the brain. In the brain, number of specialized ganglion present. Having that few is distracted. How? Production of dopamine neurotransmitter in the brain get reduced. If the ganglion get damaged, dopamine production, neurotransmitter production get reduced. Without neurotransmitter, dopamine impulse will not transmit in the brain. So what is become a symptom? You know, Parkinson only most affecting to the cerebellum. Okay, second largest part of the brain. You know, cerebellum's main character what? Maintaining equilibrium, right? Look symptoms. Loss of the body balance losing, irregular movement of muscles not supporting to move, shivering of body, continuous shivering of body, profuse salivation. Saliva come out from the mouth continuously. Okay, epilepsy. Epilepsy same as you know, Pete's and epilepsy same. What is causes no epilepsy? Continuous and irregular flow of electric charge in the brain. In the brain, no electric charge become a short. You know, positive negative charge become contact short. That is known as continuous and irregular flow of electrical charges in the brain. In the brain, normally you know, electrical charge that is becoming irregular, may increasing. Movement of electric charge increases in the brain. That is also a chance to be epilepsy. Okay, epilepsy patient what will do? Epilepsy due to continuous muscular contraction, muscle become a contract loose. Frotty discharge. Frotty means saliva. Come out discharge from the mouth. Clenching of teeth, grinding. Both upper teeth and down teeth grinding. Grinding means moving left and right by crashing. Which are the patient becoming unconscious. Unconsciousness means bodham kettidu vidnu, unconsciousness. Understood? These are the symptoms of epilepsy. Understood? Epilepsy means what? Okay. This is all study, and you have to study and write, okay, in the notebook. Study, and most student not send, okay, last days biology notes. You must to send this one. Okay. Look, let us assess. Try to find the answer of this one. Okay. First one, look what question. The part of the brain which help maintaining the balance of the body. Balance of the body. Is it cerebrum, cerebellum, medulla oblongata, thalamus? Which one? Good. Cerebellum. Correct. Can you identify second one? Identify the relation, fill in the blank. Irregular flow of charge in the brain. Okay, epilepsy. Decreasing the production of dopamine. Dopamine. Yes, Parkinson, dopamine. Page number 19, refer, okay, tab 1.3. Question number 3. Analyze the following situation. Answer the question. A thorn pierces on the foot. Thorn, mullu, pierces, tarchi, kalk. Okay, on the foot. The leg is withdrawn, suddenly withdrawn. The thorn is taken out slowly. Okay, one thorn pierces on the foot. That time what you did? Leg withdrawn, reflection action. Okay, and you remove the thorn from the foot. Write the stimuli and responses. Here stimuli what? Responses what? You have to identify. Can you find out? Withdraw response, no? Withdraw responses, right? Stimuli, a thorn pierces. Correct? Was the leg withdraw after sensing the pain? Identify the reflex action. Prepare the illustration through part through the which impulses were transmitted. This is no answer. You have to take. Was the leg withdraw after sensing pain? Yes, no? Paining, suddenly withdraw. And you have to draw this one. How to draw, no? Your page number 16 take. 16. Look at this. This is the answer, okay. But here what, no? Hand only touching the hot object. But you have to draw what? Leg. In the place of hand, draw the leg. And in the place of candle, draw the one thorn, mull. Then all same, okay. Stimuli, right in the leg. Receptor, generating impulses. Sensory nerve, carrying impulses to the spinal cord. And spinal cord you have to draw. In spinal cord, one neuron is there, interneuron. Interneuron what? Connecting the sensory neuron and motor neuron and generating the response according to the sensory impulses. Later motor neuron draw, carrying impulses from spinal cord to the relative muscles. Then relative muscle withdraw the hand. Hand don't write here, leg write. Okay, leg no asked here. Leg, the action of muscles. Understood? This is you have to draw. If it is leg or hand, answer same. But if it is hand, right hand. If it is leg, just change it, withdraw the leg by. Then all same. What is first? Stimulus. Second what? Receptor, generating impulses. Third sensory neuron, carrying impulses through the spinal cord. Next interneuron, neuron that connecting the sensory neuron and motor neuron, generating the quick response according to sensory impulses. Then motor neuron will come out outside of the spinal cord, okay, carrying impulses from spinal cord to relative muscles. Then relative muscle, what will do relative muscle? Withdraw the hand by the action of muscles. Understood now? You have to study and write it on the notebook. Submit today before 7 p.m. Okay, don't delay. Okay, thank you. Look the video and subscribe. Okay, if you subscribe you will get the next notification. Okay, if you have any doubt related to this chapter, you can ask personally or group. I will explain any topic in this chapter. Okay, July month you have the examination, for that study well. Study well, okay, study well and score good marks. but you have to submit your notes through the Google form. If inconvenience, you can send it through the WhatsApp, but don't delay. It will affect it to your upcoming marks. Okay, bye.